welcome to our podcast, which focuses intensively on health and healthy aging. In today's episode, we focus on the topic increasing longevity through current scientific findings. We now have the knowledge to help us look young, feel strong, and live healthy lives that last more than 100 years. But with so much health information and conflicting longevity implications contradicting clinical screening guidelines, it can be very difficult for most people to know where to start. Which diet is the best? Which blood tests? How do I care for my skin? In this episode, we present you with an overview of the latest health data from global clinical databases. As always, the sources are available in the description. Here we focus on clinically proven facts and leave out some aspects such as fasting or calorie restriction. Although we believe that many of these methods can be important for a long, healthy life, today we will only show you the clinical perspective. We will examine and explain 14 essential elements of health, starting with nutrition. Nutrition is extremely individual, and what works for one person may not necessarily work for another. While there is no universal perfect diet, there are basic principles that can guide us toward healthier choices. The foods we choose have a significant impact on our health and life expectancy. A recent 2022 study suggests that switching from a typical Western diet to a more optimal variant could extend life by more than a decade. This section covers the 3 essential macronutrients: proteins, carbohydrates, and fats. It is important to tailor these recommendations to your individual taste preferences. The goal is to create a flexible framework that you can adapt to your own needs. Make sure your diet not only nourishes your body, but also fits your lifestyle. Let's discuss lean protein intake. Protein plays a central role in our body, from repairing tissue, building muscle, producing enzymes and hormones. As we age, maintaining adequate protein intake becomes even more important to combat muscle loss, known as sarcopenia. Why is protein so important as we age? Well, consuming larger amounts of protein is associated with a lower risk of all-cause mortality. And interestingly, this association is even stronger among those who consume primarily plant-based proteins. A 2022 meta-analysis found that older adults who do resistance exercise achieve more significant strength gains when their diet is supplemented with protein. Ideally, we should aim for a protein intake of 1.6 grams per kilogram of body weight per day. With a body weight of 80 kilograms, this corresponds to 128 grams of protein per day. To reach the 128-gram goal, an 80-kilogram person would need to eat either 1,444 grams of cooked chickpeas or 500 grams of beef. We don't want to advise you to do that. We only use these examples to illustrate how difficult it is for most people to reach the recommended protein intake. In addition, adults over 60 should consume even more protein, namely 2 grams per kilogram of body weight per day. This adaptation is intended to compensate for the accelerated muscle loss experienced by older adults and the reduced protein absorption from the intestines. Ideally, you should distribute protein evenly throughout the day and eat enough protein every 3 to 4 hours to regenerate your muscles. Good sources of lean protein include legumes such as beans, lentils, chickpeas, and peas, protein-rich vegetables such as spinach and broccoli, unsalted nuts and seeds, fish and seafood, eggs, and lean meats such as chicken or lean cuts of beef and pork. But as mentioned, it can still be very difficult to reach the recommended daily protein intake, so you can consider adding a protein shake to your diet. Just make sure that the protein shake contains little sugar. The next macronutrient is carbohydrates. Try to eat mostly whole, unprocessed carbohydrates such as fruits, vegetables, and whole grains. These are complex carbohydrates that are digested slowly, keeping you full for longer and keep your blood sugar levels stable. We want to limit our intake of processed carbohydrates like white bread and pastries. These can lead to a rapid rise in blood sugar levels and are often low in nutrients. The final macronutrient is fat. Prioritize consumption of unsaturated fats, which are found in foods such as avocados, nuts, seeds, and extra virgin olive oil. We want to limit our intake of saturated fats, which come from foods like fatty beef and full-fat dairy products. Above all, avoid trans fats, which are often found in many processed foods. The foods we want to eat are avocados, nuts, seeds, fatty fish, extra virgin olive oil again, peanut butter if it is a low-salt version, chia seeds, and flax seeds. But even when you're eating the right foods, there are some common pitfalls that can trip people up, starting with coffee and caffeine. Although the stimulating effects of caffeine are well known, not everyone takes full advantage of caffeine's benefits. Caffeine has many positive effects, such as improved exercise performance, an association with a reduced risk of Parkinson's, Alzheimer's, stroke, and depression, potential cardiovascular benefits such as lower blood pressure and a lower risk of cardiovascular disease, and an association with a lower risk of type 2 diabetes, non-alcoholic fatty liver disease, liver cancer, and all-cause mortality. However, it is important to consume caffeine consciously. It has a very long half-life and stays in the body for a long time. This can affect our sleep. Even though some people claim that they can sleep after an evening coffee, caffeine can still worsen sleep quality. For optimal benefits without sleep problems, it is advisable to limit caffeine consumption to 4 to 5 hours after getting up and drink no more than 2 to 3 cups of coffee per day. The next common dietary mistake is salt and sugar. Too much salt consumption has been linked to high blood pressure, which is a risk factor for heart disease and stroke. Meta-analyses of randomized controlled trials examining reducing salt intake show a clear trend. When we eat less salt, we have lower blood pressure. Although our bodies need a certain amount of salt to function properly, most people eat far more than the recommended daily amount. Here are some tips to reduce your salt consumption. Always check food labels. You will be surprised how much salt is in everyday foods. Reduce your intake of processed foods. It's better to cook at home because it allows you to control the amount of salt you use. Season your dishes with herbs and spices instead of relying on salt. Watch out for sauces and dressings, which are often a hidden source of salt and sugar. It's best to make them yourself and read the list of ingredients. Above all, drink water. If you're craving a lemonade, choose a sugar-free version. Although it is not a health drink, it is a better choice compared to its sugary counterpart. Remember, this isn't about avoiding certain foods and food groups completely. We want to make informed decisions based on the fundamentals we've discussed. The second of the 14 basics of health is exercise. Exercise is an important part of a healthy lifestyle. It promotes both physical and mental well-being. Large observational studies suggest that regular exercise reduces the risk of all-cause mortality. We have divided this section into beginner, intermediate, and advanced. Starting a fitness journey requires both the right mindset and physical activity. So be aware that transformative results take time. It's the consistent, small steps you take every day that build up over time. As highlighted in James Clear's book Atomic Habits, it's about getting 1% better every day. Although these small changes are barely noticeable, they add up and produce big results. Your own pace is crucial. Even if you are drawn to intense exercise sessions, it is important to start slowly and gradually increase the intensity. This approach not only promotes a lasting exercise habit, but also reduces the risk of injury. Remember, it's about longevity and consistency, not just intensity. Before you focus on specific exercises, you should understand the importance of habit formation. That's why I strongly recommend that you set aside a set time every day for your fitness. This daily consistency helps anchor your new routine. If you have a smartwatch, track your daily steps and incorporate walking into your routine. For example, you can park your car further away from your workplace so that you have a 10-minute walk to your office. At lunchtime, before you eat, take a 5-minute walk away from your workstation and then back again. Not only will this increase your daily step count, but it will also give you a mental break. And in the evening, you can take the same 10-minute walk back to your car. By following this routine, you'll easily achieve the recommended minimum amount of daily exercise without feeling overwhelmed. And you don't need expensive equipment or gym memberships to start your fitness journey. In fact, your home offers you many opportunities to get active. One way to make it easier to get started with regular physical activity is with exercise snacks. These are short, frequent bouts of activity that can be just as beneficial as longer, structured exercise sessions. Here are some exercise ideas. You can do push-ups, squats, lunges, glute bridges, planks, wall sits, standing calf raises, and arm circles. And be careful, consistency is key. So once you start incorporating these activities into your daily routine, we can start thinking about longer runs. However, in the beginning, it is important to start slowly to minimize the risk of injury. And if running isn't suitable for you, you can use an exercise bike. This can be an excellent environmentally friendly alternative. Now we come to the exercise guide for advanced users. As you move from beginner to advanced, the focus shifts from establishing a routine to optimizing and varying your exercises. Here's a guide to help you with this phase. That's why we want to continue to incorporate exercise into your daily life. So watch your steps. Take the stairs rather than the elevator. Park a little further away from your destinations to encourage walking. The practice snacks and at-home exercises you learned in the beginner portion are crucial to maintaining this momentum. Once you've developed the ability to jog for 20 minutes, we want to build on that by aiming for at least 180 minutes of Zone 2 aerobic exercise per week, ideally spread over 5 days. So what is Zone 2 training? This is training at a heart rate that is approximately 60 to 70% of your maximum heart rate. This zone is often referred to as conversational pace, meaning you should be able to carry on a conversation without getting out of breath while exercising. Zone 2 training has many benefits, such as building a strong aerobic base, which is important for improving endurance and overall fitness. Exercising in this zone encourages your body to burn fat as its main source of energy. This can be beneficial for those who want to reduce their body fat. Zone 2 workouts are also less stressful on the body. They are therefore ideal for active recovery days. To calculate your Zone 2, you can estimate your maximum heart rate using the formula 220 minus your age. Then calculate 60 to 70% of that number. For example, if you are 30 years old, your estimated maximum heart rate would be 190 beats per minute, and your Zone 2 would be between 114 and 133 beats per minute. You can easily incorporate this into your daily activities. For example, you can walk briskly, as mentioned earlier, park a little further away from your workplace, take a brisk 10-minute walk to and from your office. This allows you to easily do up to 20 minutes of training in Zone 2 per day. If you want to watch something on TV, you can buy a cheap used exercise bike and use it while watching your favorite show. An alternative to an exercise bike would be an ergometer. So that's it for aerobic activity. Now let's talk about strength training. Because the higher our muscle strength, the lower our overall mortality rates are in old age. To avoid or delay muscle loss, known as sarcopenia, our goal is to maximize our muscle strength in youth, maintain muscle strength in middle age, and minimize loss in old age. This is the part where we move from home training to gym training can switch. For the best results, consider hiring a personal trainer to create a customized program for you. And regular monthly or quarterly check-ins are essential to ensure you're on track and that your exercise technique and form are correct. Here are some guiding principles for a well-structured strength protocol. We want to do strength exercises at least twice a week. However, for optimal results, consider increasing this to 4 or 5 sessions per week. Always start and end your workout with a 5 to 10-minute warm-up and cool-down period. We increasingly want to overload our muscles. Here's how we do this safely. We want to choose weights that allow us to do 15 to 20 reps before we reach failure. By failure, I mean that you cannot repeat that particular exercise again. We want to repeat our sentence about once or twice before we reach this point. This minimizes the risk of injury. The stronger you get, the more weight you can lift. Adjust the weights you use so that you can complete 15 reps before your muscles fail. Do 2 to 3 sets per exercise to optimally increase your strength, and take a break of at least 2 minutes between sets. Perform these exercises with a full range of motion to activate all muscle fibers. It is very important to balance your workouts by training both pushing and pulling muscle groups. The third of the 14 fundamentals of health is sleep. Good sleep hygiene can significantly improve your sleep and therefore your health. Here are some sleep hygiene tips that can help you sleep better. Maintain a regular sleep schedule. So go to bed and get up at the same time every day, even on weekends and days off. This rhythm helps your body develop a natural sleep rhythm. Enjoy the sun. Try to get at least 30 minutes of natural sunlight per day, especially early morning sunlight. This helps synchronize your sleep rhythm. Only go to sleep when you are sleepy, so only lie down when you are exhausted instead of spending too much time in bed. And if you can't fall asleep, get up and do something relaxing until you feel sleepy again. Avoid sleeping during the day, because this can disrupt your sleep rhythm and mean that you are not tired in the evening. And before you go to bed, take a hot bath or shower. This raises your body temperature, and when you come out of the water, your body temperature drops, making you sleepy. Check your mattress and pillows. The basis for a good night's sleep is a comfortable bed, and the lifespan of a mattress is around 9 or 10 years. Pillows, on the other hand, only last 2 years because they attract dust mites. Solve your worries. This brings us to the fourth foundation of health, mindfulness and meditation. Mindfulness is the practice of bringing attention to the present moment and accepting it without judgment. It's about being able to fully concentrate on what's going on around you without being distracted or overwhelmed. Mindfulness can be practiced at any time of the day, whether you're eating, walking, or even doing household chores. Meditation is a more formal practice in which you specifically set aside time to cultivate mindfulness or other mental qualities. Regular meditation has numerous benefits such as reduced stress, improved emotional well-being, increased self-awareness, increased attention span, improved sleep, and lowered blood pressure. Remember that mindfulness and meditation are skills that take time to develop. Start with just a few minutes a day and try to incorporate them into your daily routine. The fifth foundation of health is youthful-looking skin. The skin is the largest organ in our body and protects us from environmental influences. One of the best things you can do for your skin is to avoid excessive sun exposure, which is crucial to preventing premature aging, hyperpigmentation, and skin cancer. The first step to youthful-looking skin is sunscreen. Daily use of sunscreen is essential for skin health. Not only does it prevent skin aging, but according to some studies, it can even reduce some of the signs of aging. There are two main types of sunscreens, chemical and mineral. Chemical sunscreens absorb UV radiation and, despite some concerns, are safe according to current research. Mineral sunscreens, on the other hand, contain ingredients such as titanium dioxide and zinc oxide. These sunscreens reflect UV radiation. They are considered safe, but they may not protect you as fully as the chemical versions. If you buy a chemical sunscreen, make sure that the sunscreen contains bimotrizinol as an active ingredient. The second step is retinoid creams. Retinoid creams are an effective tool in the fight against skin aging. They accelerate skin regeneration by stimulating cells to produce collagen fibers and improving blood supply and nutrition to the skin. There are two main types of retinoid creams, adapalene and tretinoin. A large 2018 study found that both creams significantly improved wrinkles and other signs of aging, with no significant differences between the two. However, it should be noted that adapalene is less irritating than tretinoin. Retinoid creams should be used at night, and initially they can irritate the skin. That's why it's recommended to start by applying the cream every 2 or 3 nights, and then gradually increase the frequency until your skin adapts. And remember, always wear sunscreen when using retinoid creams because they can make your skin more sensitive to the sun. And be careful with retinoid creams if you are pregnant or trying to become pregnant. The third step is collagen peptides and hyaluronic acid supplements. Collagen is an important protein that gives the skin structure and elasticity. However, it is estimated that adults over 80 have 75% less collagen in their skin than young adults. Taking 10 to 15 grams of hydrolyzed collagen can help rebuild it. The situation is similar with hyaluronic acid, which is essential for skin health and decreases with age. Luckily, just like collagen, we can rebuild our hyaluronic acid. Multiple human randomized controlled trials, including an unsponsored conflict-free trial in 2021, demonstrated significant improvements in skin health with hyaluronic acid supplements, including an 18.8% reduction in wrinkle depth. The fourth step is vitamin B3. Vitamin B3 or niacinamide improves the skin barrier function, increases moisture, and improves the complexion. It also reduces the pigmentation, spotting, and redness associated with aging skin. It is beneficial to have a slightly higher dose than the recommended daily dose because of these effects. The sixth foundation of health is dental care. Good oral hygiene is essential not only for your dental health, but also for your general well-being. There is evidence of a link between poor oral hygiene and cardiovascular disease, so we want to make sure we brush our teeth at least twice a day. A toothpaste containing fluoride helps strengthen tooth enamel and reduce the risk of tooth decay. When choosing a toothbrush, consider an electric toothbrush. Floss at least once a day and have regular dental exams and cleanings at least every 6 months. The seventh foundation of health is sunglasses. We want to protect our eyes from the sun's UV radiation. Overexposure to UV rays can lead to conditions such as cataracts and macular degeneration. However, it is beneficial not to wear sunglasses early in the morning. As we discussed in the sleep section, exposure to early morning light can help regulate your sleep-wake cycles and support your health. Health foundation number 8 is no smoking and limited, or ideally, no alcohol. Number 9 is current vaccinations. Vaccinations are one of the most important and effective methods of protecting yourself against infectious diseases. The Standing Vaccination Commission, STIKO, issues vaccination recommendations for infants, children, adolescents, and adults, which take into account the benefits for those vaccinated as well as for the public. The STIKO vaccination calendar shows you which vaccinations are recommended for you. You can find the link to the vaccination calendar in the description. Number 10 is a blood pressure of under 120/80 measured at home. Blood pressure is an important aspect of health. It is the force with which your heart pumps blood throughout your body, and it is important to keep it in 1 to maintain a healthy range. High blood pressure, or hypertension, can lead to serious health problems such as strokes, heart attacks, vascular dementia, and kidney damage. Monitoring your blood pressure at home with an automatic blood pressure monitor is a good idea. It allows you to control your blood pressure and notice trends or changes, but it is definitely not necessary to check it extensively. You only need to check it every 2 to 4 weeks. That should be enough to identify a trend. For younger adults under 60, your blood pressure should ideally be at or below 120/80 in a relaxed sitting position. However, for older adults, it may be acceptable to have a slightly higher value, around 130/90. This higher threshold balances the benefits of lower blood pressure with possible risks, such as dizziness and falls, that can occur if values are too low. Achieving healthy blood pressure can often be achieved through lifestyle changes, such as eating a healthy diet like the ones we discussed in the nutrition section, including a low-salt diet and no alcohol. We should exercise regularly, sleep well, manage our stress, and keep our weight under control. In addition to diet, exercise, and sleep, new therapies called GLP-1 drugs can also help us regulate weight. However, these lifestyle changes may not be enough for some people. In such cases, it is advisable to consult a doctor. It can help us find out why our blood pressure is high. It could be due to problems with the kidneys, hormones, or certain medications. If necessary, doctors may prescribe medications such as angiotensin II receptor blockers to lower blood pressure. However, we should always try to reduce the medication dosage by improving lifestyle if possible. The 11th basis of health is blood tests. Blood tests for early detection are a cornerstone of preventative medicine. They can identify potential health problems before they become serious and guide both treatment and lifestyle changes. But it's important to approach these tests carefully. Not every test is necessary for every individual, and the concept of pre-test probability should guide decisions. A little more about the pre-test probability. Before ordering a test, it is crucial to consider the pre-test probability. This concept refers to the likelihood that a person has a disease or condition before any tests are performed. If the pre-test probability is low, even a positive result may mean the person does not have the disease. This is called a false positive finding. Conversely, if the pretest probability is very high, a negative test cannot rule out the disease. This is called a false negative finding. Ordering tests with a low pretest probability can result in unnecessary treatment, anxiety, and expense. Instead, here's the screening algorithm that the guidelines suggest for preventive care. For people between the ages of 18 and 35, you should have a blood test, which measures various components of the blood and can detect disorders such as anemia, infections, or other diseases. Lipoprotein A should be done once in a lifetime. Elevated levels are associated with an increased risk of heart disease, so a once-in-a-lifetime test is usually sufficient because lipoprotein levels are primarily genetic, and the ideal level is less than 60 nanomoles per liter or less than 30 milligrams per deciliter. We also want to have a cholesterol blood test done. This is important for assessing a person's cardiovascular risk. Ideally, we want to have an LDL cholesterol level of less than 70 milligrams per deciliter, but the lower, the better. If you want to pay for additional testing, ApoB is a good one. It gives a more comprehensive insight into a person's risk of heart disease, and the ideal level should be less than 60 milligrams per deciliter. HbA1c measures your average blood sugar levels over the last 3 months and helps diagnose and monitor diabetes. Creatinine assesses kidney function, and sodium and potassium are important electrolytes that indicate various conditions. If you are between 18 and 35, this set of tests should be done at least once in your life. And if you are over 35, these tests should be repeated at least every 5 years, unless problems have been identified placed. There are a few other considerations, such as ferritin, which measures your iron levels. Although it is not routinely screened for every adult, it is important for those who are at higher risk of iron deficiency. This includes premenopausal women and people who have medical conditions that cause blood loss or iron malabsorption. Next is hypothyroidism. Subclinical hypothyroidism is common, but most asymptomatic non-pregnant adults are not routinely screened. Only people with a slightly increased risk are screened because the result does not change our treatment. The situation is similar with liver function tests. They are not routinely screened unless there is a specific reason, such as alcoholism, obesity, a family history of liver disease, autoimmune diseases, etc. In conclusion, although blood tests are very valuable for early detection, they are tailored to individual needs must be customized, taking into account each person's unique health history, risk factors, and concerns. Now let's talk about cholesterol, because it's often misunderstood, especially on the internet. Cholesterol is a fundamental component of our cell membranes. It plays a crucial role in hormone and bile production and performs various other important functions in the body. Without cholesterol, life as we know it would not exist. But we have also known for decades that every cell in our body is capable of producing its own cholesterol, and organs like the liver can produce extra cholesterol and send it to other cells in the body that may need a temporary boost. This cholesterol travels through our bloodstream, neatly packaged into spherical structures called lipoproteins. The cholesterol we measure in our blood represents only a tiny fraction of the body's total cholesterol content. And during this transport process, some cholesterol can build up in our blood vessel walls, potentially causing blockages. This process is known as arteriosclerosis. Roughly speaking, lipoproteins that transport cholesterol in our blood are characterized by either an ApoA or an ApoB protein. In particular, lipoproteins that contribute to blood vessel blockages are of the ApoB type. These include lipoprotein A and all types of low-density lipoproteins, or LDL. Research has clearly shown that actively lowering a person's LDL cholesterol and or ApoB levels can reduce the risk of heart attacks. In addition, recent studies suggest that using medications to lower LDL cholesterol to very low levels does not pose significant risks. Importantly, these low cholesterol levels are not associated with cognitive impairment, Alzheimer's disease, or problems with testosterone levels. And that makes sense because our cells can all produce their own cholesterol. When it comes to optimal LDL cholesterol levels, 2018 guidelines from various heart health organizations suggest that while there is no universally ideal LDL level, the principle remains that lower is usually better, especially if your LDL cholesterol is below 100 milligrams per deciliter. For those who are at moderate risk of heart disease, we want a lower level, below 70 milligrams per deciliter, and achieving these goals may require a combination of a healthy diet, regular exercise, and in some cases medications such as rosuvastatin, ezetimibe, or PCSK9 inhibitors. Finally, there is a common myth that claims that LDL cholesterol does not contribute to blood vessel blockages and that insulin resistance is the real culprit. This belief, popular in certain food communities, lacks evidence. The PISA study found a significant correlation between LDL cholesterol levels and the presence of blood vessel blockages, even when other risk factors such as blood sugar levels, blood pressure, inflammation, and insulin resistance were at optimal levels. Specifically, for every 10 milligrams per deciliter increase in LDL cholesterol, there is an 18% increased chance of having blockages in the blood vessel walls. This reinforces the idea that desirable LDL cholesterol concentrations are likely much lower than those currently recommended, and it suggests that atherosclerosis occurs in men and women above an LDL cholesterol threshold of about 50 to 60 milligrams per deciliter is created. In summary, the lower your LDL cholesterol and ApoB levels, the better protected you are. Number 12 of the 14 basics of health is early cancer detection. Early detection of cancer can significantly improve the chances of successful treatment and survival. Screening tests can find cancer before a person has symptoms. The following information is based on American Cancer Society guidelines. Starting with breast cancer, women between the ages of 40 and 44 have the option to begin annual mammograms if they wish. These annual mammograms are recommended between ages 45 and 54. And starting at age 55, women can either continue with annual mammograms or switch to biennial mammograms. And screening should continue as long as the woman's health is good and she is expected to live another 10 years or longer. For cervical cancer, screening should begin at age 25, and women should have a pap smear and an HPV test every 3 years. Over age 65, women who have been regularly screened for cervical cancer and had normal results may stop testing. For colorectal or colon cancer, screening can begin from age 45, as also recommended by various health organizations in the field. You can opt for the chair-based FIT test and repeat it every 2 years. From 55 to 75 years old, you can consider a colonoscopy and repeat it every 10 years. And over the age of 85, it is generally not recommended to continue colorectal cancer screening. Lung cancer screening begins at age 50, but should only be done for people who have a 20-pack-year smoking history and who currently smoke or who have quit in the last 15 years. Prostate cancer screening is typically performed starting at age 50, and you should discuss the potential benefits and risks of screening with your doctor. If you decide to get tested, you should have a PSA blood test with or without a rectal exam. A few additional notes. We have multi-cancer screening tests that have the potential to detect more than one type of cancer from a single blood sample. This blood is tested for DNA or proteins from cancer cells. Although these tests are very exciting, they are not intended to replace existing cancer screening tests. They are still being evaluated, and more research is needed to determine effectiveness and accuracy. The final screening I want to discuss is full-body MRI scans. There is no evidence that these imaging techniques improve survival or the likelihood of finding a tumor in asymptomatic patients. The risk of false positive results can lead to unnecessary testing and additional medical costs. Medical societies do not recommend full-body scans for people without symptoms, but there are a few other screening programs that we can consider, which are number 13 out of the 14 in the Health Essentials. Starting with osteoporosis prevention, we can use DEXA scans to assess a patient's bone strength. Women aged 50 and over may consider a DEXA scan if risk factors for osteoporosis are present. But all women 65 years and older should have a DEXA scan. Men, on the other hand, should only consider a DEXA scan if risk factors are present. These risk factors include a previous bone fracture, smoking, excessive alcohol consumption, liver disease, and certain medications. The final health staple after you've done all the other 13 is supplements. Starting with creatine 5 grams, it is the most effective nutritional supplement currently available for athletes to increase high-intensity exercise performance and lean body mass. It can also improve memory performance. Omega-3 is associated with a 13% reduction in heart attack risk with high certainty, according to a 2021 Mayo Clinic meta-analysis. A low-dose multivitamin and mineral supplement can supplement a healthy diet, fill nutrient gaps, and support your nutritional needs when your diet is lacking without overdosing. Daily multivitamin and mineral supplements have been shown to improve global cognition and memory, as well as executive function in older adults over 3 years. Trimethylglycine 500 milligrams lowers homocysteine levels. High homocysteine levels are associated with Alzheimer's disease, but it is unclear whether lowering homocysteine will reduce Alzheimer's rates. Trimethylglycine is also likely to improve muscle performance during exercise. Hyaluronic acid 200 milligrams, as we mentioned earlier, reduces skin wrinkles by 18.8%. Collagen peptides 10 to 15 grams also reduce skin wrinkles by about 8%. Psyllium husk for extra fiber helps lower total cholesterol and blood pressure, a 2016 Cochrane review shows. The final supplement is melatonin. A low dose of melatonin of about 300 micrograms taken 1 to 2 hours before falling asleep can help people fall asleep a little faster. Finally, we come to the end of today's episode. We greatly appreciate your time and interest and hope that we were able to provide you with valuable and new insights. Until next time, stay healthy and take care of yourself.